Assalamu alaikum dear doctors. In this video I am discussing a video station. So first we will watch the video, then I will discuss what type of question we are expecting from these video stations. Observe in this video I can see a child who is very young, maybe less than 5 years of age. I am seeing that the child is on respiratory difficulty. There is shortness of breath, respiratory distress, respiratory rate is increased. There is subcostal, intercostal retractions, and there is a sound during respiration, that is wheeze present. So according to age, my probable first diagnosis, it can be episodic viral induced wheeze, and the second, it can be multiple trigger wheeze or bronchial asthma. So if the child is less than 5 years of age, DD, what we have viral induced wheeze is if child less than 5 years, bronchial asthma, early onset, multiple trigger wheeze we can say, and secondary to wheeze due to chronic chest conditions. These are including any cystic fibrosis, immunodeficiency, anatomical malformations, bronchiectasis, bronchiolitis, and obliterans, bronchiolitis obliterans. Now, what history we ask in episodic viral induced wheeze? First of all, that onset course in duration, first time or recurrent occur. Character of the cough, is it chesty or wet? Then, is there any cyanosis, pallor, shortness of breath, chest pain, dyspnea on exertions? Then about fever, weight change, activity, appetite, sleep, and any neck swelling. Timing. So timing, like, is it more at night or the same all the day? How many times per day? How many times per night? Number of attacks per week and per month if already known case. The triggers of viral induced wheeze, these are only after cold or triggered by food, exercise, pollens, etc. Is he free in between the attacks? Atopic march, like itchy nose, itchy eye, eczema, and food allergy. Family. In family, we'll ask that history of any similar condition or atopy, home condition, aeration, about smoking, garden, pets, nearby constructions. Vaccination status, we ask like any extra vaccines, COVID exposure recently, COVID vaccination of the parents. Any treatment he is taking like inhalers, compliance to treatment, any peak flow diary. Team he is following with any chronic illness, growth and development, short stature, obesity. So these are we ask. Short stature, obesity, we know that. Steroid toxicity, sign of steroid toxicity also we can ask in history. Then what examination we do in viral induced wheeze? First, the ABC, air breathing and circulations, vitals, oxygen saturation, cyanosis, alert or not, can complete the sentence or not. Via can complete sentence or not, we can determining the severity of the level. Then about chest examinations, expiratory wheeze with prolonged expirations. If chronic patient on steroid inhaler, search for signs of steroid toxicity, Cushing-Guide features. So, sign of steroid toxicity, you all know that hirsutism, that is excessive hair, moon face, buffalo hump, not buffalo hump, there is intrascapular pad of fat between the scapula, stria of the skin, these are, and gynecomastia. Now, what are the investigation we do? No need for investigations unless if in life-threatening asthma or not sure about the diagnosis, sudden deterioration. So, no need investigation unless the life-threatening asthma. These are first chest X-ray, we find hyperinflated chest. Then pulmonary function test, if FEV1 by FVC less than 80% or obstructive lung disease is an asthma. We do ABG, urean electrolyte, and random blood glucose to monitor the signs of salbutamol toxicity. About management of viral induced wheeze. So viral induced wheeze, first we give a relief of the inhaler such as salbutamol. We start with the short-acting beta agonist, we know. Then steroid tablets, prednisone we can give 2 to 3 days are used to settle down the inflammation in the chest. Montelukast tablets and ipratropium inhalers. Most children with viral wheeze will not need a regular preventer inhaler. Then asthma predictive index API, used for children 2 to 5 years with episodes of wheezes during first 3 years of life, at least one diagnosed by doctor. Then it can predict those more likely to develop asthma if 4 wheezing exacerbations in past year, with 1 physician confirmed episode plus 1 major criteria or 2 minor criteria. Now some major criteria of the asthma. These are parents' history of asthma, doctor diagnosed atopic dermatitis, sensitivity to allergens in the air as determined by physician through positive skin test, blood test, or to allergens such as trees, grasses, weeds, molds, or dust mites. Then minor criteria of the asthma, blood eosinophils more than 4%, wheezing unrelated to cold, doctor diagnosed allergic rhinitis, patient with allergy to milk, egg, or peanuts. Now, difference between the episodic viral induced wheeze and multiple trigger wheeze and bronchial asthma. So, episodic viral induced wheeze and multiple trigger wheeze or bronchial asthma, both are same, multiple trigger and bronchial asthma. So, episodic viral induced wheeze only during viral infections, where bronchial asthma plus minus any cold weather, exercise, excitement, pets, smoking, pollens. Viral induced wheeze in between the child otherwise well. But in bronchial asthma, what happened? Interval symptoms are present between the exacerbations, like wheeze, cough with activity, excitement, and cold weather. Viral induced wheeze, no personal or family history of atopic disorders. But in bronchial asthma, there is positive family history of asthma or atopy. Viral induced wheeze, that is, age is common, less than 2 years, where multiple trigger wheeze is age more than 2 years. Now about discharge home the same day. If number 1, child has made a significant improvement and has determined stable for 4 hours. So if child has significant improvement and remained stable for 4 hours, then we can discharge the same day. And parents, what we give? Understand use of the inhalers. Have a written personal asthma action plan, PAAP. Then have a written discharge or weaning salbutamol information leaflets. Know how to recognize signs of deterioration and the actions to take. Discharge treatment, what we give? Prescribe beta agonist with spacer. So beta agonist salbutamol we are giving, short acting beta agonist mainly at the beginning we give. Age less than or equal 3 years with mask. Age more than 3 years without mask. Example, volumetric or aero chamber. Then give prednisolone daily for 3 to 5 days and preventor as appropriate. And educate on use of PEF, peak expiratory flow rate meter, if age is more than or equal 5 years. Discuss the follow-up in either the community, nurse lead asthma clinic or consultant clinic and with GP within 2 working days. Identify the trigger of acute attack and discuss the future management plan for exposure. And if there have been life-threatening features, refer to pediatric respiratory specialist. So this is all about viral induced wheeze. It's also common history. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.